You're exhausted. No matter how much you sleep, the fatigue remains. You're drinking water constantly, yet the thirst never leaves. These are polydipsia and polyphagia, physical alarm bells signaling that the body is losing control of its internal environment. At its core, diabetes is a mechanical failure. A specific microscopic sensor has broken down, leaving the body unable to process and regulate the very energy it depends on to function. This table identifies the exact thresholds where this failure becomes a clinical crisis. A diagnosis is confirmed when fasting glucose reaches 126 milligrams per deciliter, or when the HbA1c, the 3-month average of blood sugar, hits 6.5%. This creates a physiological paradox. While the bloodstream is flooded with an abundance of fuel, the actual cells are effectively starving because they cannot access it. These are the islets of Langerhans, specialized clusters of cells located within the pancreas. Our focus is right here in the center, the blue beta cells. Beta cells make up roughly 70% of this neighborhood, and they are the body's exclusive producers of insulin. This illustration details the insulin trigger mechanism. It functions like a microscopic vending machine, dispensing insulin only when specific conditions are met. In step 1, glucose enters the cell through the GLU2 channel, much like a coin inserted into a slot. Once inside, glucose is processed into ATP. This energy surge shuts the potassium door, changing the cell's electrical charge in a process called depolarization. This electrical shift opens the calcium doors. As calcium rushes in, it signals the cell to release its payload of insulin. This microscopic sequence is the only way the body successfully converts chemical energy in food into a form cells can use to sustain life. The question then becomes, what happens when this precise trigger mechanism is destroyed or ignored? This breakdown shows two distinct paths to failure. In type 1, the cause is autoimmune. The body attacks its pancreas, destroying the insulin factory. Type 2 is a resistance issue. The factory produces insulin, but the cellular receptors intended to receive it are essentially jammed. Whether the cause is autoimmune destruction or cellular resistance, the result is the same. The engine halts and the body enters a systemic biological crisis. To manage this, medical professionals have to replace a sensitive biological trigger with artificial tools. This chart shows the insulin spectrum. We use different kinetic profiles to match metabolic needs. Rapid-acting Lispro creates this steep blue curve, peaking within 2 hours to handle post-meal spikes. In contrast, the purple line, long-acting Glargine, provides a peakless 24-hour baseline energy coverage. Managing diabetes effectively means the patient acts as their own manual beta cell, deploying distinct curves to match food intake and activity levels. But precision is mandatory. Mismatching the timing, such as taking rapid insulin without eating, causes blood sugar to plummet into a dangerous crash. Long-term mismanagement leads to irreversible damage. Chronic high glucose levels result in the complications listed here: nephropathy in the kidneys, neuropathy in the nerves, and retinopathy in the eyes. There are 3 clinical priorities. Identify your specific disease mechanism, match the insulin spectrum to lifestyle, and keep HbA1c below 6.5%. By mastering the cellular mechanism and utilizing the correct pharmacological tools, patients can prevent microscopic damage from escalating, restoring a normal, healthy life.